Peter. I'm
How you doing?
Jason. I'm a student physical therapist. How are you today?
Good. How are you?
Doing good. Why don't you tell me a little bit about what brings you into that?
Yeah. So just getting just a constant like a deep ache and pain in my right shoulder.
Okay. So, when did that pain start?
It's kind of it's not really like acute. Like it's been like just like gradual.
So just gradually came
Yeah,
on over time.
I
You
can't
don't know
specifically
exactly
put
when
like a
it
time
started.
point on it.
So there's nothing specific, like injury or anything that brought it on?
I don't think so. I just I have a like I mean it might be from my job. I just have a kind of like a physically demanding job that just kind of requires me to kind of use this like motion like just like kind of overhead over just different motions.
So what do you do for work?
I'm a construction foreman,
And how old are you?
55.
So mainly you're having difficulty with just overhead movement at work, you having any other symptoms that are making it worse for you, maybe like lifting, things like that?
Just kind of reaching for like high shelves, lifting materials at work, and then just kind of if I sleep at night on the right side, kind of bothers it a little bit just sleeping on it.
And are you able to get back to sleep after that, or
Yeah, it's not too bad where it like limits me from sleep.
just mainly just
Yeah,
positioning?
yeah, positioning.
Has anything you found made it any better?
Um,
Maybe resting or medications, things like that?
I feel like if I don't use it as much, it gets a little better. I have been taking acetaminophen for it for the past month, just kind of for the pain.
And that's been helping?
Not necessarily. It's not. Sometimes it helps, sometimes it doesn't. So I guess it's like just kind of like not consistent. Like I'll come with it, so, but I still use it.
And you described the pain to just be deep and aching in your right shoulder. Does it
Yeah.
ever go past the shoulder into the
No.
arms, into the fingers?
No, it stays pretty local to the shoulder.
Any symptoms of numbness or tingling?
No,
Okay. And then as far as the pain goes, do you have any symptoms at rest? If you were rated 0 to 10, 0, no pain?
0. Just kind of at rest. Mostly when I kind of just engage in like movement. I'd rate it like a 7 or 8 probably.
7 or 8. Activity, okay. And then like throughout your course of the day, when you wake up in the morning, is it more painful than it is in the afternoon versus?
I don't think so.
Mainly just activity based,
Yeah.
I think it's like overhead reaching or like
Yeah,
lifting.
yeah.
Okay. And then have you ever had any popping, snapping, clicking?
No,
Okay. Any symptoms at your neck that you were concerned about?
no.
I'm just gonna ask a question like past medical history. Is there anything important that I need to know there?
No, I don't think so.
No past medical history. And then have you ever had another shoulder injury maybe? Okay. Have you seen anyone else for this before me?
No, I just been taking just over the counter stuff. I haven't really seen anybody for it.
Okay. Have you gotten any imaging done now? And then, just as far as your goals for physical therapy, what are you looking to get out of this?
Just kind of decrease my pain, and gain some, I guess, like mobility back as well. Because I feel like I am limited in some motions as well, as I previously described. But yeah, I think those are just kind of the main things. Just kind of decrease my pain and just get normal function of my shoulder back.
Yeah. Okay. So I think we could move on to some of the objective tests that I want to use at. I'm going to start out with just testing sensations, so just for safety, I just want to clear out first. So how we're going to do this is I'm going to have you close your eyes and then put your hands out like this, and I'm just going to lightly brush across places and just tell me yes or no if you feel it or not, okay?
Okay.
So close your eyes.
Yep. Yes. Yep. Yes. Yes.
Yes.
You were like here, and I was like,
Yep.
Good.
Good right now.
Then I'm gonna do a couple of range of motion tests. So I'm gonna have you scan for these. And then the first one I want you to do is just put your thumbs like this and raise over your head both at the same time first. Okay, good. Just need to bring it down. Let's just do the left and the right. And then I'm gonna put a little bit
No,
of
I meant atrophy, but I just messed it up. But I also was like, I don't know.
It's pain at the end.
So it's pain most of that end range.
I don't know.
I don't know what
And then
I
as you were lifting it, did you feel pain getting there? Is that what was lifting
I
you?
I only said it so you could look at posture.
A little pain.
Little pain?
Not a lot though.
Alright. So next one I want to do is just bring your hands out like this. We're gonna go
Both of them
no,
again.
we're both at the same time for this one.
Yeah, I mean, just by word.
See, it starts to hurt.
Okay, so right up there. Put that down. Just want to do this one now and do a little bit of overpressure again. So we lift up. That's painful for you?
Yeah, kind of. So, kind of have it worse if I go here, and then it kind of gradually goes away, and then I get the pain at the end again a little bit.
Okay. So the same thing, but we're gonna go backwards now. Okay, looks good. Apply a little bit over
Yeah,
pressure.
that's
Painful
okay.
there?
Just like a pull, like a stretch kind of.
Okay. Good.
Like with an actual patient.
And then I just want you to reach over your head like this. Okay, any pain with that?
Not really, no.
And then we're gonna go from behind like this, as far as you can go that way. And then any pain with the right shoulder with that?
Not really.
Okay. And I wanna do one more test with that. This one you do like this with both arms. Okay. And we'll do the other side. Any pain with that?
No.
Okay.
I did it, yes.
I'm just gonna take a few notes. Okay, I want to do some passive range of motion just on the table, so I'm gonna have you lay on your back. Just gonna raise it for you. Let me know if you have any pain with this.
Really good.
A little bit of pain, but throughout the range of motion, you feel this. Guys, go out like this now.
Good for us. I just had
Fine. Okay. I'm just gonna do. I'll see if I can put a couple more. Anything here? Good. Anything here?
It's just slightly like stretch.
I'm gonna do the same on the other side just to see if there's any differences there. No pain with this at all. Very good.
Why was I kind of worried that it like pop up though?
Good.
What do they do?
All good. Stretch.
Yeah.
Doing good?
Yeah, that's fine.
Okay. You can have a seat up on the table. Do a couple strength tests now. So the first one, we're going to lift your shoulders up, and I'm going to push down the resistance. Good. That's a pain there. Okay, we're going to go out like this. Any pain with this?
It's a little painful.
A little painful on the right.
Yeah.
Okay. We're gonna have you bring your hands out like this now. Let's go to this side. Good. Like that. Good. Good. Put your hands out like this. And I'm just gonna push down. Alright. That's a little painful with that. Put the other side. there. Okay. And have you bring your hands out like this. And then I'm just gonna have you push into me now. And then push out. Hurts a little go out on that side. Same here. Yeah, go out. Okay. I want to try the same at the same time. So just push into it. Okay. Now we're gonna go out. So right side, out. Okay, I'm just taking notes here. I'm gonna do a couple of palpations. I just want you to let me know if it's tender anywhere or you're feeling pain. So I'll let it right here. That's fine. Anything up here? Other than that. Okay. I'm gonna have you go back on your back for a quick second. Passive accessories, when you're pushing down at the joint, we'll start on the good side, and then that's how it's going to feel on the right side. So let me know if you have any pain here. That feels. Okay. So bring your arm a little bit off, just a little bit. There. You feel this one? That's fine. Go around to the other side now. Just gonna do the same thing on this side now.
Or no. Passive flexion, formation. Okay. So probably what I do is sit in a chair, I guess.
It's fine?
Yeah, that's fine.
Okay.
Not too bad.
You have a seat up. Okay. We do a couple, just some special tests now.
Okay.
Set it. Yeah, we're just gonna be setting for these. First one I want to do is just like test for impingement.
Okay.
So I'm gonna have you bring your arm out like this. We're gonna start on the good arm.
Okay.
And then I'm just gonna apply some overpressure. Let me know if you feel anything.
It's fine. It's just
Stretch.
stretch.
This
Hi,
high.
I'm Alex.
This.
It's fine.
Just a stretch. Nothing pinching there. Okay. One more. Gonna bring your arm out like this. Let's do that side first. Then I'm just gonna push down on it.
That's fine.
Rotate it this way.
That's fine.
Switch to the other side. Does that hurt? Rotate this way. So I just want to do another test. It's going to be a drop arm test. So start on the good side. You're just going to bring your arm out like this, and then we're going to slowly bring it back down.
Okay. Flex it or keep it straight?
So I want you to just keep it straight like this, and then you're going to slowly bring it down and control it back to your arm.
That.
Yep, looks good. Now we're going to do it on the other side. Okay, just slowly bring it back down to your arm.
That's fine.
That's fine. Okay.
Something happened.
I want to do one more test on this side. I'm going to have you go like this. That's similar to what we just did, but we're going to do it in this kind of motion. We're going to be pushing down. Then you're going to open it up. Okay. Same thing on the other side. So do that first. Now push down. Painful with that. Same thing. That's painful. or it's gonna be, I'll start on this side again, we have your hand out like this, and I just want you to maintain that position when I let go of your arm, okay? And then we'll do the same thing on this side.
So you said it's present all the time.
Just maintain that. Good. Do one more. Gonna have you put your arm behind your back like this, and then I'm just gonna have you hold that position. You'll take it off your back, hold it there. Good. This arm now. Good like that. It's fine. Alright, let's do that. So, based off the test and just what we've talked about, it's definitely weakness with overhead, definitely some weakness going out in external rotation. Your sensation was normal. The joint test that we did was normal. Your passive range of motion was good, so it's mainly just active range of motion, which would tell me that it's more of something from the tendon, so I'm thinking it's more of a minor rotator cuff tear, which has a pretty good prognosis for what I've seen based off your strength levels. Some people do think when they have rotator cuff tear they have to go get surgery, but from what I've seen so far, it is pretty reversible. You strengthen the tendon, that's all that. So we're gonna work on some couple range of motion because it is a little bit limited, and some strengthening exercises today. So we'll start with quick exercise for range of motion. So I want to just do some wall size, kind of over here.
135.
So this is how you're going to do this. Is just you're going to use the wall to help assist you bring it into that range of motion that's limited. We're going to do 10 of those right now. Let's see how that feels for you.
I don't want that. I don't want that. I want that.
And then if you have any pain with that, just let me know.
Fine. I got something. I have not.
Looks good. And then I also want to do a couple of just isometrics to help strengthen the muscle that you're having some weakness with. So if you're having weakness with flexion and also rotation, two exercises that we're going to do today is just pushing through it into the wall, tracking it, hold there, about 5 seconds, so do 10 sets of those. And then the next one, you're going to go against the wall like this, and then push it out.
Oh, good. No, I want.
And then do 10 sets of those.
Oh, I didn't bring my sweater down. Does anybody have their sweater?
How do you feel with those? It's okay. Okay? This is the other one. It's going to be 5 of those. Push elbow into the wall. Elbow into the wall. Yup.
Previous treatment.
And then we'll do 5 sets of these.
That area before. Okay. So kind of to summarize, you got the sharp pain going on in your, you say outside elbow, you have points.
Okay, cool. How do you feel with those?
Outside elbow.
Okay. Okay with them? Did your symptoms, do they got any better as you did the range of motion ones, or is it about the same?
I'd say it's about the same.
Okay. So I think what we're gonna do is just send you home with those 3 exercises to do. We'll do them 3 times a day for 2 sets of 10. So try to do like morning, afternoon, night. And then with that, you should probably expect to see some improvements within the next 2 to 3 visits of physical therapy. And yeah, so we'll just leave it at that. Alright, sounds good. Thank you for working with me.
Thanks.